Now, so let's get back before we come to this, what I suggested. This is what I was thinking after reading what you have written. You can see if you were reading, there's some things you have actually written. Okay, you should have come up with different ideas, coming up with different ideas. That's what you need to be doing. Okay, so let's see. So from what you have just talked to me now, okay, let's get back to this. All right. So what I was trying to explain, so we are talking of attitude. Okay, that's what you are talking about.
Yeah. Yeah.
Now, attitudes also they are called the perception.
Yeah.
Now, you are not doing psychology, although you did the part of nursing psychology. Okay,
Yeah.
but perceptions, attitudes, and beliefs. Okay, they are part of. They are called mediators of behavior. That's why we're using that to change behavior. The other one is knowledge. Okay.
Mm. Mm.
Okay? So all these they are mediators of behavior. So you realize that we tend to target this if we're going to change people's behavior. Yeah.
Mm.
In your mental health, one of the things you may want to do is like the patient you are telling me, they have suicidal tendencies, self-harm tendencies.
Mm.
It's the attitude they have, it's the perception they have,
Mm.
it's the belief they have. Okay. Now, if we can change this, then they should be able to move from self-harm to more living a normal life, which means they don't believe that life is worth at all. Okay.
Mm.
Right. So let's concentrate on these attitudes you're talking about. So forget about the others. You have only picked on this one. Nothing to worry at all. Okay,
Yeah.
because you're not doing education intervention.
Mm.
Education intervention, you can't just come straight to do this. There's no way. You need to improve knowledge first.
Mhm.
Okay, so knowledge, understanding, and then after that you focus on attitudes. Then
Mm.
after attitudes, you focus on perception. Then after that you focus on belief. And
Mm.
then if all these they have been successful, then you change your behavior. Okay,
Mm.
right. But let's look at this here. Okay, so here you have said cultural influences.
Mm.
All right.
Yeah.
So right. So if we look at the attitude of nurses, that's what you're interested in.
Mm. Yeah.
Now, this here, they have professional attitude and they have personal attitude and you have communal, which is a community, which is more to do with parents, what the parents have input in us. Right. So as you are explaining, you are not talking about towards people who self-harm. You are talking about these nurses, they have duties, they deliver services.
Mhm.
So they deliver services to patients. So what you are telling me, okay, when you're explaining, this is the way it sounds. It's not what you have written. What you are saying is that the attitudes, I'm just going to look at the attitudes now, but we need to look at them, okay, so that we can see how with these different types. But what you see now is you're saying, so nurses' attitude, let's just take attitude they have. So you're saying nurses' attitudes have impact on the delivery of their services to patients who suffer self-harm, which is different from what you have written there.
Mm.
Right? So the way you deliver the services to patients who are suffering from self-harm is being affected by the attitudes that you hold. Now, is this attitudes which is professional? Is this attitudes which is personal? is these attitudes which are at the communal level. So when you talk of cultural will mean coming from community, your parents, families, but also coming from the religion you are coming from.
Mm.
Now, if these are the cases, these are the situations you're talking about, then the remedy is already there. The remedy is the training you're going about. So the training you're going through is to make sure that you adopt professional attitudes, not any of these. So there's a difference between attitudes you inherit from your own parents or the ones you acquire as a result of your social interaction with people around you or in the community, which are personal. Now,
So
if this,
can you just repeat there again? Sorry.
yeah, so there's a difference. Now, your professional attitudes, they're in your NMC code, professional code of conduct.
Mm-hmm.
That includes the professional attitudes that you need to adopt as a nurse. Otherwise, you can't qualify. So a nurse who is qualified, you don't expect they should bring their own personal attitudes or
Okay.
their own family or religious attitudes towards the services. Otherwise, you are in conflict with the professional code of conduct. Therefore, you should be dismissed or terminated. And that's why they give you PIN, a license to practice. That is to confirm that you have adopted a professional attitudes. Therefore, you will be able to deliver services to patients without harming them. So this is what you need to think about. Are you saying their personal or community or religious attitudes go into conflict with their professional attitudes so that at the end of it, they are not able to deliver their services effectively?
Personal. So personal. Yeah.
Mhm.
Yeah.
Now, so the question is, which is which? That's what I asked you in the right. All right. That's what I was suggesting there when I was telling you this. Okay. So I suggest the title might be not that it should be, yeah, evidence-based report on critical evaluation and discussion of the impact of necessary personal cultural attitudes on the delivery of services to self-harm patients. So that's what you want to try to find out. Is there, okay, what sort of impact? Impact is a neutral word. It can be positive, it can be negative.
Mm.
Now, culture will involve family, will involve religion. So you should be careful there. Are you going to look at the culture in terms of religion? Are you going to look at culture in terms of family of things, which is the family?
Um. I don't know. I think.
Yeah. So that's what you need to think. You can't answer that in just a day. So you can see. So if it's religion, we expect a positive. Like you already we can say the impact is going to be positive. People
Yeah.
who are religious are supposed to be more kind.
Okay.
That's what the Bible teaches us.
Mm.
Yeah, they are more supposed to be more kind to people who are at a disadvantage, people who are sick, okay, people who are born disabled. Yeah,
Yeah.
yeah, but the other cultures, no, they're not going to be that way. No, they're going to be more hostile.
Mm.
So that's why, yeah, you need to be careful what you're talking about.
Mm-hmm. So they are more hostile, then they cannot deliver the proper care to this kind of patients, isn't it?
Yeah, if people are self harming themselves, it's like you know, someone is drunk, yeah, and then he's driving a car. He hits the tree, and then he's injured. Should we go and rescue him? No, he was doing that only deliberately. I don't care about it.
Mm,
Yeah,
okay.
but if a person who is religious does that, okay, you will see. We are saying it's not you to revenge; it's God is sin. Yeah,
Mm,
so you
mm,
can't call somebody a sinner. Yeah, it's
mm,
only God who can call somebody a sinner.
mm,
That's why he said, anybody who has never sinned, he should, yeah, throw a stone at this woman who had committed adultery.
mm,
What he was trying to say is that you can't call somebody a sinner. So you can see those are shaping us, our own attitudes, how we should behave towards the others. So
mm,
in the same way, nurses who have got that, and I told you last time, nurses who were coming from religious background, from Nkoma Synod in my country, from a Roman Catholic, you can't tell them to distribute condoms to children, yeah,
yeah.
to young people. No way. You can see now that's their attitudes towards the children engaging in sexual activity,
Mm,
because right from religion as well as their own culture back home, like in my culture where I'm coming from, you can't have sex until you are mature, but also you are married, not
mm,
outside marriage. No. So these are family values, but you have got professional values, professional code of conduct, professional attitudes which you need to adopt, and that's why you are being trained. So the choice you need to think of here is am I talking about these personal attitudes, these attitudes which are developed or influenced by religion or by the family, which we all of us adopt because our parents teaches us what we should do.
mm,
Yeah. So that's what you need to be thinking about. The second thing you need to be thinking about, do you have literature? Is there literature that you can use to support this? If the literature is not there, you can't proceed with this topic. It's going to be hard for you.
mm,
So when I look at what you, because that's what the idea I said last time, go, okay, and try to find out why you have chosen this topic. One of the reasons to why you should choose this topic is because there is a literature available. So you shouldn't say, oh, yeah, yeah, I try to search, I find plenty of evidence. But all you're doing here, you're just claiming. There's no support of what your claims are. Yeah, so you observed, yes. But does that observation going to stand in this particular? No, it's not evidence. It's not scientific, no. But you need to say, okay, so this is what I'm observing, okay? And then what does the literature say? Is there any literature which says, yes, this happens? How many people are being affected by that? Somewhere you claim that they stay longer in a hospital. Do they stay longer in a hospital because of these nurses not having positive attitudes towards these people? The answer is no. People will always stay longer because they are not responding to treatment.
mm,
Yeah, they were put in treatment. Now, if you tell me they are not receiving the treatment, yeah, so that's the impact of those nurses' attitudes towards this self harm. One of the things is not to give them treatment. So it's the delivery of services which is being affected. And as a result of that delivery, poor delivery of service, then patients are not able to recover because they are not receiving medication. And that's what you needed to try to find out. Is there any evidence? No. So without evidence, there's nothing you can do here. So you need to rethink, try to search and see what's the extent of this problem. How many nurses have been reported in a year or the last 3 years in each year per year, so I can see the trend. Is the trend becoming problematic? Is it increasing, or is it getting down? Or you can look at the cases that are referred to NMC code of conduct. Those who have withdrawn their PIN numbers. If you are able to access that, see what were the claims, what were the complaints that they were being made. Because literally, if you do according to your attitudes, your own personal attitudes, you bring that to the work, you're going to be excommunicated. You are not going to continue. They will dismiss you. They will stop you. Yeah? And your license will be withdrawn.